Right, welcome to Thursday evening breathing buddies. So last week, in the email I sent out and in the session, I asked if anyone had any questions or any direction they'd like me to take things, and I got a few responses, which is really helpful for me, and it provides just some insight into how the people are feeling in these sessions and what they're thinking about. And I think it's clear that there's lots of different ways to think about what we're doing. But basically, we're just breathing, aren't we? Just on the one hand, we're just inhaling and exhaling. But as we'll see, there's quite a lot to think about at the same time. And I think once you get the idea that you're doing something correctly, then you can start to relax a little bit more into it and stop, potentially overthinking the process. So I'm going to kind of get into the questions one by one each week, and have a little bit of a deeper dive and just try and apply what we learn to the kind of standard practice that we do each week. So the question I'm going to look at this week, it came in, was on the exhalation, is the goal to expel all the remaining air? And that's a great question. So I guess the general answer is, for these exercises, when we're doing this practice, in the evening, and the goal is to relax, we need to try to make the exhalation passive, but it needs to be controlled as well. So we're going to have a look at how we might describe the exhalation and inhalation process. So what I'd like to do first is just sit up straight if you can. This works best if you can sit up straight unsupported. We are going to first of all think about what it is to just take some breaths in. So just, you don't have to follow me with this, but just, we're going to try and inhale deep into the belly, and just feel that when you inhale, the diaphragm contracts downwards, creates negative pressure, and pulls air into the lungs. We're going to try and breathe. Sorry, if you haven't been before as well, we try and do all this breathing through the nose. If you can. If you struggle to breathe through the nose, we'll do a nasal congestion clearing exercise in a minute. But we'll ideally going to breathe through the nose the whole time. If you can't, breathe through pursed lips. So when you breathe in, the diaphragm contracts, draws air in, and then really you should just be able to, it relaxes then, and you should just, the exhalation is just passive, and it comes back to a neutral state. So you just do that a couple of times, just breathe essentially, and just feel that happening. So take an active, if you like, breath in, and then just let it fall out. Then the next time you get to a neutral lung, you can do something else active, which is to actively force out more air. So forcing more air out to the point, you could do it on and on until, if you were talking, you just wouldn't be able to speak anymore. And then it will relax back to a neutral position. So we've got full lung, neutral lung, and then a sort of forced empty lung. Now, all the exercises that we do, we're going to just work with the idea of the area between this neutral and full lung. So we're not going to be doing anything where we're forcing more air out. So I hope that sort of generally answers the question, is when we are exhaling, the goal is just to come back to this neutral position and then inhale again. The neutral position, then inhale again. In traditional pranayama, there are exercises where you do things the other way and force the air out and let it bounce back. It's called a bellows breath. Bastrika, I think. You maybe have to look that up. Maybe someone knows more than I do about that. I think it's called Bastrika. It's called the bellows breath, where we do that. So we force the air the other way and then create sort of a bellow effect. So yeah, when we're breathing, just try and breathe in low and deep into the lungs, and then the exhalation, make it as passive as you can. And the kind of contradiction there is that you also kind of need to control it. So I think it's just familiarize yourself with these exercises, and try and relax into the idea of the exhalation, and don't go past that neutral position. Of course, if you find that we're doing something where I'm asking you to do a long exhalation, you run out of air, you've got a little bit of reserve there just in case. But the idea is just to put back to the neutral position. Okay, so we're going to apply a little bit of that later. I'll just make sure we're thinking about it as we're practicing. So let's do the first exercise now. This is the nasal congestion clearing exercise. We split into two groups. Group A, people in good health. Group B, anybody who has maybe heart disease, diabetes, high blood pressure, recently had surgery, any serious mental health issues, could be pregnant or know they're pregnant, you're in group B. So the instruction for this is you're going to breathe in normally, then out normally, and then pinch your nose. And when I say pinch your nose, we're just going to cover the nostrils. Don't squeeze the soft tissue, just cover your nostrils and nod your head. So on a neutral lung, you're going to be nodding your head. If you're in group A, nod your head or move side to side or do some kind of movement for as long as you possibly can till you're feeling some real air hunger. So the air hunger is the feeling that you want to be breathing some more air. If you're in group B, don't push it. Maybe try and get to 15 or 20 head nods. If you feel like you need to take a breath before that, just take a breath. This exercise works better for group A, I'm sorry to say, but the whole experience will have a similar effect for group B. So then when you're finished, you just breathe normally in through your nose. You should feel, if you've got some congestion, it's a little bit easier to breathe when you take that inhalation in. So when we're ready, breathe in normally and out normally. Then pinch your nose and nod your head. If you're in group A, keep going as long as you can. If you're in group B, 15 or 20 times. If you feel like you need to breathe though, just stop. The longer you can do this for, the more effective it is, but we don't push it if we're not in good health. And then when you're done, breathing in through the nose, deep into the belly. Hopefully you feel a little bit of nasal relief. Then what we need to do now, what's happened there is we've allowed carbon dioxide to build up in concentration in the blood. It's the feeling of carbon dioxide building up. That's the air hunger. That's the driving force to take the next breath. It's the primary trigger to take the next breath. If we did the exercise straight away again now with elevated levels of carbon dioxide in the blood, nobody will be able to do it for as long. So you've got to let those levels diminish just by breathing normally a few times, and then we'll have another go before we get into the practice proper. So take another couple of normal breaths in and out. And then when you're ready, breathe in normally and out normally. Pinch your nose, nod your head, hold your breath. Group A for as long as you can. Group B, try and get to 15, 20 times. But if you feel like you need to breathe, just stop immediately and start breathing normally. And then when you're done, breathing in through the nose. Now, if you have trouble with nasal congestion, this can be life-changing, like seriously. And I think it should be taught to everybody, but it's surprising how difficult it is to get hold of this knowledge, but share it far and wide, please. Right, let's get into our practice. So, sitting up nice and straight. Let's start with one hand on your chest, one hand on your belly, just above your navel. If you're comfortable doing so, close your eyes. And just begin by noticing, how are you feeling right now? How is your breath right now? How's your breathing, I should say? Is it fast? Slow? Is it high or low? In other words, which of your hands can you feel moving? Is it easy to breathe through your nose? There's a little bit of congestion. Is there a sort of tone, a way you could describe to yourself a way you're feeling right now, generally? Something you might be able to draw back on later. So now you're aware of how you're breathing right now. we're going to move into the first exercise. This is called Breathe Light. So I want you to start just by noticing the air as it moves in and out through your nose. Notice the slightly cooler air as it enters your nose on each inhalation, and the slightly warmer conditioned air as it leaves your nose on each exhalation. See if you can make your breathing silent. We're going to breathe light, which means breathing quietly. Feeling the cooler air entering your nostrils and the warmer air leaving your nostrils. And as we've taken the attention inwards, just trying to relax. Just have a little scan around the places where we often hold tension. So, how's your jaw feeling right now? That's often the place we hold tension. You need to give it a bit of a wiggle, a bit of a shake. It can help to loosen your jaw and then place the tip of your tongue about 1 centimetre up above your back teeth on the hard palate. What about the neck and shoulders? Can you drop the shoulders a little bit? It can be easier to drop the shoulders if we're breathing deep into the belly. By breathing nasally, it encourages us to breathe diaphragmatically, to breathe using the primary breathing muscles, which are the diaphragm and some of the lower intercostal muscles. Now, the instruction for the breathe light exercise is quite simple, but it's tricky to get right. And it's just to breathe a little bit less air. And you need to be very aware as you're doing this what the goal is. The goal is to feel a little bit of air hunger. Air hunger is the feeling that you would like to be breathing a little bit more air. It's that feeling that if you held your breath, it would grow and grow and grow and grow until you could not ignore it and you had to take another breath. And we just want to flirt with that feeling. We want to step up to the line, wherever it is for you, and just hang out there. So we start by trying to breathe maybe 70% of the volume of air that you have been breathing normally. If you start to feel panicked, if you start to feel that your breathing is becoming erratic, just step back. Breathe deeply and step away from the exercise for 30 seconds or so. And then if it feels okay, try and breathe a little bit less air again. I use the analogy of surfing the wave of air hunger. We want to catch that wave and ride it. It's the benefits here not gained by sitting behind the wave. We also don't want to get wiped out by the wave and feel overwhelmed by it. It's a subtle liminal space to try and inhabit. The reason we do this is that there's chronic hyperventilation across society, we lead stressful lives. We often have relatively poor diets, which puts the body into a state of stress. We breathe faster. As a result, we breathe beyond our metabolic needs, which is the definition of hyperventilating. Hyperventilating doesn't need to mean having a panic attack. It can just mean breathing more than you need to in any given moment. When we breathe more than we need to, the concentration of carbon dioxide in our blood drops, the partial pressure drops, and we need carbon dioxide. It's a vasodilator. It helps to open up the blood vessels, improve blood flow around the body, and it's the catalyst that allows oxygen to be released from red blood cells. So when we breathe a little bit less air, we try and breathe very light and very quietly for a little while each day. We allow carbon dioxide to build up in the blood. And the way we know we're doing it right is that we feel a little bit of air hunger. We feel like we'd like to be breathing just a little bit more than we are. That is the carbon dioxide tickling your chemoreceptors. And over time, the body adapts. You can tolerate more carbon dioxide. And as a result, you naturally start to breathe more slowly. Now you may notice as you're doing this, you start to relax. It can help you focus. You might notice your hands getting warmer. Maybe your feet are getting warmer because the blood vessels have dilated. Maybe there's been a little bit more saliva production as we're moving into parasympathetic state. Again, can you breathe just a little bit less air? If I was in the room with you, I'd be saying, can you hide your breath from me? So it would be so that I couldn't hear it, but also to a degree so that I couldn't see it if I was sat a couple of meters away. It's an impossible task, but it's something to aim for. As little movement as possible. Just to reiterate, if it starts to feel like your breathing is becoming erratic, if you start to feel anxious, take a step back. Take some deeper breaths. Okay, you can rest your hands on your lap now if you haven't already. Just going to concentrate now for a second. You can take some deeper breaths, deep into the belly. Drop that exercise. Feeling the belly moving in and out. You also want to feel the ribs moving out laterally. On each inhalation, feeling the ribs moving out. The lower two ribs especially. On each exhalation, feeling them contract inwards. If you're unsure if that's happening, you can put your hands, rest your hands on the lower two ribs. As you feel the diaphragm descending, you should also feel the ribs expanding. A healthy breath is in 360 degrees around the body. Belly moves out, ribs move out to the sides. Ribs also move out to the back. So the goal now is to take deeper breaths, but fewer of them. Often what I do here is I guide the pacing of this by counting. I'm going to do it just very briefly, just to get an idea of what sort of pace we're looking for. But sometimes it's not for everyone, so I'm going to drop that fairly quickly. But what we're going to try to do is essentially have an exhalation that's longer than the inhalation, and a little pause at the end of the exhalation before you breathe in again. So I'm going to count in for 4, out for 6, little pause at the end. We've got to get in sync for this. So when you're ready, exhale, then breathe in, 2, 3, 4, out, 2, 3, 4, 5, 6, pause. Breathe in, 2, 3, 4, out, 2, 3, 4, 5, 6, pause. Breathe in, 2, 3, 4, out, 2, 3, 4, 5, 6, pause. Breathe in. Now just do this at your own pace, whatever serves you right now. Let the length of your inhalation determine the length of the exhalation. It should be longer. It doesn't matter how much longer. The longer you can make it while still feeling comfortable, the better. And then a little pause at the end. The goal, if we're in good health, is to try to get down to about 6 breaths per minute when we're doing this exercise, or any time at rest really, which is about the pace I was counting. So now as you're doing that, can you take your mind back to what I was saying at the beginning? The inhalation is active. The exhalation is passive, but we need to control it. But can you, even when you're breathing slowly like this, can you just let the air fall out effortlessly until you reach that neutral lung? Little pause, and inhale again, deep into the belly. Then just relax the air out. No need to force it. It will leave of its own accord. Can you control the pace without tightening up? Now for the last couple of minutes, you can either stick with this or see if you can also add a little bit of air hunger to this. So can you breathe less air while still breathing at this pace? Can you find the beginning of the feeling of air hunger, the beginning of the feeling that you'd like to be breathing a bit more air, and just hang out there? Nice long exhalation. Little pause at the end before the cycle starts again. Can you breathe so lightly that even the hairs inside your nose don't move? Okay, start just deepening the breath a little bit now. Draw up the exercise. Just let your breathing now get back to where it wants to be naturally. And then just check in again. How are you feeling now? You're breathing fast, breathing slow, breathing high, breathing low. You feeling any different to at the start of the session? Has breathing a little bit less air, breathing a little bit slower than usual, breathing deep, light, slow and deep. Has that changed your state of mind? When you're ready, you can open your eyes. Thank you for joining this week's Thursday Evening Breathing Buddies.